We have been joined by Dr. Gbemdu. I'm sorry.
Oh, that's quite all right.
Okay, from the Henrietta Johnson Medical Center. We've had the Henrietta Johnson Medical Center on so many times, and it's our great pleasure to have them on again.
Thank you.
I'm so happy to meet you. Thank you for coming on the program.
It's truly my pleasure. Thank you. Good
Now,
to be here.
how long have you been at the Henrietta Johnson Medical Center?
Well, I began just as a family physician in January 2015 as
Okay.
a part-time physician at Henrietta Johnson Medical Center. Interestingly enough, as payback time for the National Health Service Corps, through which Henrietta Johnson participates. That time was fulfilled, and here I stay. I became the Chief Medical Officer in November of 2016.
So I think a lot of viewers may be familiar with the services offered there, but for those who are not, can you just describe some of the things that are available there?
Absolutely, it'd be my pleasure. So Henrietta Johnson Medical Center is a federally qualified health center. What that means is the federal government has charged us with making sure that we take care of those who might not otherwise be able to have access to primary care. So we are the catch-all for those who might be uninsured, underinsured. You can also be insured. We want to take care of everybody. So we welcome those who are without insurance, those who have insurance with large copays, those who have insurance without large copays. We do our best to take care of the entire community.
Now, I've been dealing with Henrietta Johnson for a while, and y'all have so many different things there where I think when I was speaking with Ms. Ella, that a lot of people just don't understand there's so many things that can get done by just coming there.
Absolutely. Our primary focus is primary care, so we don't ever want to understate that. But we also offer services in women's health. We offer services in dentistry. We have a dental, we call it clinic, though I don't like the word clinic because they're scheduled appointments and everyone's treated as an important individual at the facility. We also provide behavioral health for our patients. We offer free screenings. We even Miss Elle and I were discussing that there's also a pet program that happens once a month at Henrietta Johnson on Saturday mornings. So that folks who have their small animals, dogs and cats exclusively, can come get basic vaccinations and basic care, and then get referred outside if they need more of that.
Well, the one Saturday that we were there, that you had the rowers set up, they were the pet van was there the same day.
Oh, it was? But that was the day where men, I always tell you, come to breaking barriers, this is where you should be going
Absolutely.
also. Because that's another story. I'm not going to talk about the
one thing that we've noticed, because we have done a couple of events at Henrietta Johnson, is it feels like there's a large focus on wellness and preventative care as well.
Absolutely. Our primary focus is to keep people well, and if we can do those screenings and get folks in a timely fashion, then we can prevent the long-term effects that we see that break our hearts. So we are strong in working on colonoscopy screenings and other colon cancer screenings. We offer a mammography van that comes to the facility both at this site and also at the Claymont Community Center in Claymont, Delaware as well. So every other month you have access to a mammography van for a very menial fee if you don't have insurance. If you have insurance, you're welcome to come as well. But if you don't have insurance, you're welcome to come as well. And that fee, I think at the moment, is about $30, which is a great deal.
It really is.
So we're really excited about that. We also have a diabetes class that meets. The upcoming class will start, and everyone is welcome to come. You don't have to be a member of Henrietta Johnson Medical Center to attend, though we encourage you to become one. But if you're not, we still welcome caretakers and family members, et cetera, to come, and that class will begin on October 9th for 6 weeks.
Okay, and then also, I know upcoming would be the free eye exam.
Absolutely.
And I did have that memorized, but now I don't.
Well, we'll let you cheat.
The free eye exam's coming up, if I can just take a quick peek of that.
Absolutely.
That is on Saturday, November 3rd, 8 to 11. No appointment is necessary. Children are welcome. That is at 601 Newcastle Avenue.
Absolutely.
And At that time, there will be certified diabetes educators on site, flu shots offered, blood sugar, cholesterol screenings, cancer risk assessment by the Christiana Care Health Services. So a lot of stuff going on Saturday. It's only a couple hours, 8 to 11. You guys are packing a lot of stuff in.
We are, but it's always a wonderful, exciting event, and it's always, you're right, it is a lot that's packed in those hours, but it's so much fun, and I love to see the community come out and be a part of it. We open the doors, and we're so excited when people come in. It's I don't know if they're like television shows where they come on in, everybody,
Yeah.
and you get plowed over, and it's so beautiful. We love
Actually,
to
I
have the
just
folks in.
remembered I did go to that last year.
Oh, there you go.
Yeah, I went for the show. I wasn't going for an eye exam.
Ah.
But yeah, it was crowded.
It-
There were
it's
a
good
lot of
time.
people
it
there.
It really is a good time, and there are lots of exhibitors who come out and show their wares and tell about their services, and it's nice when we can all come together as a community and serve our community for free. Let's keep that in mind, for free.
Yeah. So what's that date again, so everyone to know?
Absolutely. It's Saturday, November 3rd from 8 to 11. Please come out.
And then also there are Al-Anon classes
Absolutely.
available. I'll just quickly go over that. We've been
I'm not
showing
sure
the
what that's
flyer.
Okay.
I don't see the Al-Anon.
Yeah, it
Is
might be on page 2.
Okay.
there.
We've been showing the flyer a little bit, but Al-Anon is, well, we'll put that up. But also behavioral health.
Which is a program that we've had in place for the last two years, I'd say. And we're working with a wonderful model that enables us to serve a lot of the mental health needs of the community. We have a wonderful licensed clinical social worker on staff by the name of Joan Fletcher, yay Joan, who is a great resource in the community, and we have a care coordinator who works directly with her. We have another counselor on staff who only specializes in substance and alcohol abuse, and she is such a go-getter, Sheila Nichols, in the community, and she just does her best to go out there and help all those who might have addiction problems. She's a great resource for connections to other resources, and she is wonderful in spearheading the Al-Anon program.
Now the behavioral health and the addiction,
Yes,
is
sir.
that just a certain age, or is that open from one age to adults?
Our primary focus right now is for the adult community. Give us time and we'll expand that. We're actually looking to expand our behavioral health program within the next days, thanks to some wonderful work from our CEO, who couldn't be with us tonight because of a sick child.
Okay.
But we've opened our ability to see more folks, and we hope to bring in more talent and be able to serve the community even better.
Well, that's fantastic. And this is our first time meeting you, but we are very, very well acquainted with Nizella, and she knows that if there's ever anything that the Henrietta Johnson Medical Center needs, that we were more than happy to help. We
we're so
like to come
grateful.
to, she always invites us to the events. We
Please.
come, he sets up some rowers, or we
Yeah,
videotape,
we've run into you.
and it's just, we think it's such an important service that's provided to the community.
Thank
so
you.
You guys are welcome back anytime.
Oh,
was
so
nice
thank
meeting you.
you. It's
You're
a
very welcome.
pleasure. Thank you.